periodontal examination and probing. In a periodontal examination, your dentist will do oral cancer screening of inner teeth or tongue, missing or loose teeth. Examine the color, texture, size and shape of your gums. Conditions of any restorations such as fillings, crowns, bridges, dentures or implants. Tooth plaque. The depth of the space with gum and tooth. Gum bleeding during probing. Gum recession, reduction. How teeth fit together when you bite. In addition to the periodontal examination, you also may need X-rays of your teeth. Diseased gums tend to swell and detach from the tooth, forming pockets. If the depth of detachment is more, then it requires immediate attention.